Cannulas and catheters are both flexible tubes that can be inserted into veins or cavities to remove or introduce fluids, provide medication, or withdraw blood. Some medical professionals use the terms interchangeably, depending on country or region. However, there are usually distinctions drawn between the two. A catheter is typically referring to a larger plastic tubing that is inserted into an area of the body that already has an opening, such as the bladder or an open wound that needs assistance in draining. A cannula typically refers to a small plastic tubing that is inserted into part of the body with the aid of a needle that punctures the vein or vessel. The needle is then removed, leaving the cannula in place for easy access to withdraw or inject anything into the vessel. IV cannulas and nasal cannulas can pose different risks. IV cannulas present minor risks to a person. Some potential risks include mild pain at the insertion site, blood clot formation, infection at the insertion site, bleeding, bruising. In a 2014 study, researchers found that humidified nasal cannulas may increase a person's risk of rainout aspiration. Rainout aspiration occurs when the air in the oxygen tank is warmer than the air in the room. The temperature difference can cause condensation in the tubing, which can lead to a person breathing in water through the nosepiece. This could be an unpleasant experience but could also result in a person drowning. Standard, low-flow nasal cannulas (LFNC) can lead to a greater risk of airway inflammation because of the colder, drier air they introduce to the body. This risk is decreased with the HFNC. Cannulas are flexible tubes attached to a person's body that can introduce or drain different things. A doctor or nurse can use an IV cannula to introduce medication or take blood, or a nasal cannula to give oxygen to a person. IV cannulas can reduce the need for needle pricks and make it easier to deliver of medication or fluids to a person's body. Nasal cannulas can help a person who has difficulty breathing by providing them with more oxygen. Cannulas are generally safe. There are minimal risks associated with cannulas, including a minor risk of infections and a risk of the formation of blood clots in IV cannulas.